How TENS bug the muscle pain. The method directly treating painful lesions. The reflex tracts of the central nervous system are interconnections through which the most diverse parts of the central nervous system and the body parts are interconnected. The sensation of pain is sent via the afferent channels of specific pain receptors, the so-called nociceptors, to the central nervous system. The superficial receptors of the skin are called exteroreceptors, and they also convey feelings such as touch, expression, cold, and heat via the reflex tracts. The delivered impulses reach the subcutaneous center of the central nervous system and the cerebral cortex. The proprioceptors in the muscles, which are also in the joint capsules and periosteum, bones, muscle tendons, give nerve impulses of the central nervous system about the condition of the musculoskeletal system. Nerve impulses for pain are sent to the central nervous system via the reflex tracts in the flat vessels and internal organ muscles. The cerebral cortex connects the functions of the cross-maintained muscles with the internal organs, regulating the functions of the subcortical cores and transmitting information about the functions of the internal organs. Certain parts and zones in the skin, connective tissue, muscles, and bones have reflective connections with the internal organs. These spinal cord segments are metameric, and alterations such as pain, increased sensitivity, increased or decreased muscle tone in the musculature, skin, periosteum, and other tissues are observed in cases of internal organ disease. Transcutaneous electrostimulation is a battery-powered device. The effect is exerted by electrodes on the skin. Broad analgesic spectrum of activity, 30 to 50 Hz. The strength of the current is sufficient to create a feeling of pressure without pain. The electrodes can be placed locally in the painful areas or by reflex protection of the spinal column segment, as well as by trigger points in the most painful areas. The healing mechanisms of TENS. TENS inhibits the delivery of pain impulses to the brain by stimulating the sensory nerve. Premodulation on spinal cord level. TENS. Electrical pulses at a rate of 120 mm/s are sent to the horns of the spinal cord and carry the sensors from the skin receptors due to electrostimulation. This affects the afferent pain signals. The nociceptors that carry the sensations of pain transmit brief impulses through slowly conducting neurons that fuse the cells that transmit the suppressed pain. Nerve root damage. Radiculopathy. Expressed with motor and sensory changes and parts. Face, neck, shoulder girdles, upper limbs, skin dermatomes, protrusions of sensory nerves of the chest, back. Reasons. Osteophyte bone deposits in the cervical spine, herniated disc with pulp prolapse, spinal cord sprain. Narrowing in the exit of the nerves. What about bones and arthritic changes, edema, diabetes, traction, traumatic nerve root injury, repeated stress? Herpes simplex. Postoperative shortening is caused. The most common symptoms are pain, sensory abnormalities of the dermis of the sensory nerves, migraine, neuralgia, frozen shoulder, reduced movement in the following parts, head and neck, shoulder girdle and upper extremities. Feeling reduced. Combination of physiotherapy with electrotherapy. The changes that have occurred have worsened the quality of life and the psycho-emotional status of those affected. Motor and sensory changes in the lumbar spine. Pain due to compression of the spinal nerve in the lumbar region. Radicular pain due to root irritation of the spinal cord brain. Combination of physiotherapy with electrotherapy. Combination of physiotherapy with electrotherapy.